vaccinated than we do. And or two, what we're primarily concerned about, which is non-optimal or possibly somewhat decreasing vaccine efficacy over time. However, vaccines are still the best protection that we have against COVID-19 infection, and especially for severity of outcomes. This remains apparent in the data. For example, in June of 2021, 55% of fully vaccinated cases were symptomatic, compared to 86% of non-fully vaccinated cases. Only 6 out of the 132 COVID-19 hospitalizations, or 4.5% in June, were among vaccinated persons. And none of the 18 people who died of COVID-19 in June were fully vaccinated. For a bit more perspective, as of last week, there were 750,881 persons in the county who were fully vaccinated. Only 1,231, or 1.7% of these fully vaccinated persons have later become cases, and only 389, or 0.05% of these fully vaccinated persons have later become symptomatic breakthrough cases. So really the message is get the vaccine before it's too late. Given the rate of spread in our community, the choice to vaccinate or not to vaccinate is likely the choice to eventually get COVID-19. There is no supply shortage when it comes to the vaccine. You can go to myturn.gov, you can go to the Sacramento County COVID-19 vaccine webpage, or you can call 211 to schedule an appointment. That's all. I'll turn it back over to Sam.
You're muted, Sam.
With that, we will open it up to questions. As I requested, please raise your hand if you have a question for the public health officer or staff. Michael, let's start with you.
Hi, this is Mike from the SAC-B. The statement that went out about the mask order this morning said that it would be necessary until the local vaccination rate increases. Right now it's 49%. Is there any numeric target or goal that Sacramento County has in this time that it's aiming toward, or is it just as high as possible? Thanks.
Definitely as high as possible. Our goal has been 70%, and we continue to try to reach that.
Forgive me if I butcher this. Lisi?
Say hello. No worries. With KCRA, so just wondering, the CDC and the state have said they're recommending, not mandating, fully vaccinated people wear masks indoors. So why do you feel the need to make it a mandate instead of a recommendation?
If you read their recommendations, both of them do state that this is especially important for areas that have high transmission, and Sacramento County is in that category. And so that is why we felt strongly that we needed stronger language. We already had a strong recommendation, and we wanted to take it the next step, which is the health officer order.
I'm going to jump to Sammy.
Hi, Sammy from CAP Radio. Can you detail the plans to enforce the mask mandate, especially given that mask recommendations were lifted 2 weeks ago?
It will be it will really depend on the workplaces, and that's exactly what we did even prior when we had the masking mandate.
So just to follow up, how will you ensure that workplaces are enforcing this?
The same way that we did before, and we have information that we're putting out to the different workplaces, and we do have inspectors who go to some of these workplaces to see that there is compliance.
Luke?
Hi, guys. So a lot of the chatter that we're seeing online, people are asking, could this lead to new capacity restrictions? Is that something that you're ruling out right now?
We are not considering capacity restrictions. If you notice that this is strictly a masking mandate, we have not made any reference to physical distancing. Part of that is this time around, as compared to the health order that we issued last year, is that we do have the vaccine, and that continues to be the most important way for us to increase protection. But in the meantime, especially because we are still seeing this increase in rates, we wanted to be able to provide information about additional ways that people can protect themselves.
If I could just follow up, what do you attribute to the lower than ideal vaccination rate, and should the health department take some responsibility for that?
We are doing everything that we can to increase the vaccination rates. We still have teams going out, and we are receiving requests to go and set up vaccination clinics in different places. We do work with community-based agencies, especially because when you look at the areas that tend to have the low vaccination rates, they are in underserved communities, and there might be barriers to them being able to access the clinics that we have. So in being able to work with community-based agencies and doing more outreach, we are able to get to those people.
Heather?
Hi, good morning. Heather with CBS 13. Kind of jumping off of Luke's question right now. If we were to look back at the metrics, we would be in the purple tier, which limited a lot of things that we could do. I guess I just want to have Dr. Cassidy comment on kind of the trend, where we're headed, and kind of we were at the worst level, and we're back there again.
That is true, and that is why we're at this point where we felt the need to issue the health officer order. We continue to encourage people to get vaccinated because that is the best protection that we have. And again, as I mentioned, last year we did not have the vaccine, and that's why we had the additional measures of the shutdowns. But now our main push is for vaccination. But in the meantime, because of the increase in rates, we felt the need to also issue the order for masking indoors.
Lisa?
Hi, one more question, doctor. So can you explain, some people might be confused about why, if the vaccines are still shown to be effective against the Delta variant, then, why vaccinated people should wear a mask? Does it have more to do with the spread and higher viral loads among vaccinated people with this Delta variant? Can you explain that, please?
Sorry, sure. Yes, from the data, we know that the Delta variant is a lot more contagious. And what we've heard from both CDPH and CDC is that for people who get infected, they tend to have higher viral loads. And when you have a situation where you have increased transmission in the community, you increase the risk both for the vaccinated and unvaccinated. Of course, the majority of our cases, about 90% of our cases, are still among people that are not vaccinated, but we still have 10% that are vaccinated. So we know that there is some risk, and so the need to take additional preventive measures.
Sammy, go ahead.
Do you have an update on how many people have gotten their first shot but never got their second shot? And how are you following up with people to make sure they get both?
Yeah, so that's turned out to be a really interesting project and kind of an ongoing project. Our team has done a lot of outreach. As they started with the 65 and older to do outreach and to see if persons needed a second dose. And what we found is that actually most of them had already received a second dose, and it was just a delayed reporting issue or a data issue within the state database. And so we're working with the state right now to clarify that and clear that up. So our rates of missed second doses are a whole lot lower, and that's probably the case statewide than what we initially thought from doing individual outreach to those persons.
Okay, thanks. And just really quick, do you have a number of breakthrough cases? I figure.
Yes. So right now we have there have been 389 breakthrough cases in the county as of Tuesday. And breakthrough cases are fully vaccinated cases that are symptomatic.
Okay, and that number is since when? Since which day?
Since
January.
Yeah.
Since January. Okay, thank you.
Since forever, since there's been a vaccine available. Yeah.
Got it.
And I would also, maybe to like circle back to Luke's question a little bit, I wanted to say that our team is doing 20 to 25 pop-up vaccination sites a week. They're really working very hard to make sure that vaccines get out to all corners, of the county. And if you remember back in the beginning, there was 1 week where we got a single tray of Pfizer back when the demand was really high. So we kind of started out behind and never were able to catch up from Sacramento County not getting its full allocation right in the beginning.
And if I could just
Mike, right before you, Mike, go ahead.
Sorry. Yeah, I was just going to ask, has there been any increase in the rate of new vaccinations over the past, say, 2 or 3 weeks since we started hearing this increased concern about the Delta variant? And if so, is there any sort of demographic trends in that increase, or are certain age groups, for instance, getting vaccinated in higher numbers?
In terms of the demographics, I'd have to get back to you. I don't have the exact numbers in front of me, but in June, there was about 134,000 doses administered. And from July 1 through the 22nd, there was about 54,000. So if there has been an increase, then it's happened in the last couple weeks. We haven't really seen it in the numbers yet. That said, our team has had a huge increase in requests for pop-up sites. And those pop-up sites tend to be smaller than they were in the beginning. So we're getting more requests for more locations, but they're smaller clinics.
Who is requesting are these workplaces or employers, or?
Megan, do you want to?
Sure. Yeah, I would say that the majority of requests we receive are from businesses, but also community-based organizations. A lot of the businesses are open to having public clinics outside their businesses, and quite a few churches. So we've been looking at food pantries and food distribution sites as well, just to try to spread out the number of clinics throughout the county.
Luke, go ahead.
Okay, and I didn't mean to suggest that you guys aren't working hard. I know you guys are. But at the same time, something about this approach appears not to be working. So what do you say to folks who are frustrated or discouraged that we appear to be once again moving backwards?
You mean moving backwards in terms of the case rate?
Yeah.
Is that what you mean?
In terms
Yeah,
of
so
case-
I think
yeah.
one of the things to recognize is that when we got to June 15th, we were heading in the right direction. And our case rate went all the way down to 3.9. And we anticipated that even though the vaccination rate the rate at which we were doing vaccinations had reduced, that we would still be able to handle and have a continuing downward trend in the cases. What has happened in the meantime is that the Delta variant has become the dominant variant. And as Jamie pointed out, the last number of reports that we got, all of them were the Delta variant. And from reports you've heard from the state as well, over 80% of the cases that are sequenced are the Delta variant. So it's different from the one that we were dealing with before. The variant that we were dealing with before, this one is a lot more contagious. And that's what we're seeing, is that it started spreading, especially among the unvaccinated. And then in terms of the vaccination, I think we definitely would want to have more people accessing the clinics right now, but we are also very cognizant, and we were aware that as we go down to these smaller clinics, that it would be much harder work, in some situations, we have had the CBOs go from door to door, encouraging people to come out and get vaccinated. So it is hard work, it is slower, and the clinics are smaller, but we continue to make progress.
And just one last question from me. Would we be here if the vaccination rate were higher?
It's hard to say because we are looking at some of the other counties. I think it's important to note, for example, when you look at the case rates for California, is that Sacramento County has one of the highest rates. And I think that if we had been able to get higher vaccination rates, especially in some of the zip codes that now have low vaccination rates, I think we would have had better community protection.
Karma, go ahead. Okay, then we will move on to
It's
Alex.
on
I
mute,
think
Sam.
she's,
I was on mute. I'm still here. Sorry, Dr. Cassidy, and I apologize if you already touched on this because I was late. But to clarify, are gyms included in the order?
I'm sorry, what?
Indoor gyms. Do people now need to wear their masks when they're working out in their gyms inside?
If they are actively working, no, but once they, if they are in any other part of the gym, they should be wearing their masks just as they were doing before.
Okay, so they don't have to wear it on the treadmill, but as they're walking from equipment to equipment.
Correct.
Okay. Also, in terms of the some of the trends that you had spoken to before, I know before the supervisors, you pointed out an alarming trend, particularly with Black Sacramentans and people in Sacramento County with regards to vaccination rates and an increase in cases. Are you still seeing any of those trends with Black Sacramentans and any other groups in particular that stick out?
Yes, we still have higher rates in the African Americans, and that trend is actually true not just for Sacramento. I think when you look overall in California, you can see the same trends. And that does, I think, to a certain extent correlate with the lower vaccination rates that we have among the African Americans.
Okay. Additionally,
I'm going to ask that you get back in line and I'll call on you. Okay. Alex, go ahead.
Hi there. Thanks so much. So just a clarifying question from following up on Mike's question from the beginning. So as of now, is this health order indefinite, or is there sort of a number or a date that you guys have in mind that you think this would be lifted? And then my main question is just, are you guys watching at all the news around trials beginning for younger people potentially getting the vaccine? Are you guys watching that at all? Or looking forward to it at all? Thanks.
So in terms of the termination of this health order, we did not include a date because we are going to follow the trends. If we see a reduction in the case rates, especially if it gets down to low or moderate, then that will be an indication to us that we can lift the health order. So we will continue to monitor, and hopefully as our vaccination rates go up, that we'll get to that point where there will be a downturn in the numbers. And as far as the trials for children younger than 12 years, I know that they are ongoing. We don't have a date as to when it will be considered by the FDA. I think what we've heard from the CDC is that it's likely to happen later in the fall or later this year.
Heather, go ahead.
I just want to circle back to this and see if Dr. Cassidy could elaborate. But in terms of where we're trending, can you explain why counties like Sacramento are turning to things like mask mandates over implementing new restrictions? I think it's a concern for a lot of people wondering if and when we're headed towards that direction.
We know that masks are effective, and this is in looking at all the options, I think this would be the quickest and most easiest to implement right now. And our hope is that, especially coupled with increased vaccination rates, that will be sufficient to be able to get us where we need to be.
Brandy, go ahead.
Okay, thank you very much. I've heard the analogy that the Delta variant replicates much faster than others, dogs versus rabbits. And I believe Jamie mentioned viral load. Is there any data or percentages that you can give us that is better than the dog rabbit analogy for our readers and listeners?
I will have to get back to you on that. I'm pretty sure that that information is available from the CDC, but I will have to look for it.
Thank you.
Karma, you had another question? You're on mute.
Sorry about that. And it just goes to, and while recognizing that you're not a fortune teller, Dr. Cassidy, looking down the road, for a lot of people, this is a very uncomfortable sense of deja vu. We were at a point where we felt like this is reopening. People could start to make plans again. People can start to, reopen their lives and, plan for months down the road. And as we're starting to see things go away that we watched them go before, I guess, what advice do you have for people in looking at, that wedding for September, the vacation for October? Could we be going towards a situation where we're shutting down again, or do you expect mass to be as far as it would go?
We don't anticipate going further. We are very hopeful that with increased vaccinations that we will be able to see a downturn. But as Dr. Fauci has said before, it's the virus that is going to dictate. And so we will continue to follow the trends. And hopefully what we have in place right now will be sufficient to help us to turn around.
I'd add that, vaccination is still the best way out of this. And so for people who are vaccinated and who are frustrated, one thing that they can do is maybe talk to their friends and their family, talk to them about their concerns or their fears about getting vaccinated, offer them a ride, offer to help them schedule an appointment, because it might just be that they need someone they trust to deliver that message to them.
Heather, do you have another question, or is your hand still raised from your previous?
I have one more. I apologize if I missed these statistics at the beginning, if they were available, but I was just a couple of minutes late. In terms of hospitalizations, are we starting to see those trend back up again? I've heard anecdotally from people who work in like the UC Davis ER that they're starting to see more people coming in with serious complications who may be unvaccinated. And I just was wondering if we are starting to see that trend here in Sacramento County.
Yes, the hospitalizations have gone up. From the report yesterday, we are at 175 in the hospital.
Ask, of those hospitalized ones that have gone up, do you have a breakdown of how many were fully vaccinated and how many weren't?
We will get back to you on that. We were still doing the analysis. It takes a little bit longer with the hospitalizations because we have to request the records and then do the analysis. So it does take us a little bit longer.
I can tell you in June that were 6 out of 132 hospitalizations, but I don't have the July data in front of me.
Okay, seeing no additional questions, we are going to conclude this media briefing. Just a reminder.
There's one more.
Oh, no?
I think Luke had one more.
Oh, Luke?
Okay, just one last question. Can you compare and contrast where we were 1 year, just getting back to that deja vu question, compare and contrast where we were 1 year ago to where we are today?
If you're comparing the case rates, I believe that we are at the level where we peaked last year in July. It is different though, because this time around, we do have the vaccine, which is our main defense, and it is what we are encouraging people to do to get us out of here. So answering again the question about are we expecting additional restrictions? No, we do not anticipate to have additional, but we felt that masking would help, especially in being able to curb the risks for people that are indoors.
Okay, now I will conclude the media briefing. As a reminder, this will be a link to this recording will be posted online on the COVID website for you to review if needed. If you have any additional questions, please reach out to me at motts@saccounty.net. Thank you.